So this chapter will deep dive into the orthodontic aligners. So nowadays, most of the patient are of the opinion are having this desire to look good. Everybody wants to get treatment done, orthodontic treatment done, but that too discreetly, without letting the world know about that they are getting the treatment done. So for that, we have got only two options. We have got ceramic braces and we have got aligners. We have third option also, that is lingual brackets, right? But lingual brackets are not that much popular as aligners are. The primary reason of lingual brackets not getting that much popularity is since they are placed at the lingual side of the teeth. So the tongue interference is way too much for the patient because it exceeds the pain threshold value of the patient. The patient will experience repeated episodes of ulceration, repeated episodes of discomfort. So if a patient can afford the lingual brackets, they can very well afford aligners also, right? So let's start with the basic introduction and discussion about orthodontic clear aligners. So basically, aligners are an orthodontic treatment method in which removable, clear, semi-plastic polyurethane aligners are used to correct the malocclusion. So basically, we are doing the orthodontic treatment. The treatment what you are giving to the patient is called orthodontic treatment. The only thing what has changed is a mode of delivery of that treatment, right? So aligners are removable appliances. So till now we have talked about, all the time we have been talking about fixed appliances where the control is in the doctor's hand. You fix the appliance to the patient's mouth, you recall the patient for activation schedule for visits every once in 4 to 6 weeks, 1 to 1.5 months, right? But here, the fundamental difference between aligners and the fixed appliance treatment is that you are actually imparting the control of the treatment entirely in the patient's hand, right? Let that sink in. You are actually giving the control of the treatment entirely to the patient. You depend heavily on the compliance of the patient, how well the patient has been wearing the appliance properly. You need to send repeated reminders to the patient. You need to assess the internal motivational status of the patient, whether the patients are actually desirous of getting the treatment done themselves. So all those factors, that's what make aligners distinct from the conventional braces treatment. So the credit of Invisalign goes to Zia Christie and Kelsey Worth, who both were graduate students at Stanford's University MBA program in USA. Together, they started Align Technologies in April 1997, and today is 2026. It's been more than 29 years, and see how far we have come for, right? So this is the marketing poster which is usually used by Invisalign to market their products. So the concept of aligner treatment has its deep roots by the Dr. Kessling's diagnostic tooth setup. So this was the point which gave an idea to Zia Christie and Kelsey Worth that Dr. Kessling actually what he did, he have taken an impression of a tooth having crowding or having interdental spacing. So Dr. Kessling what he did, he separated the teeth individually from the die. He put a wax bite onto the in place of the alveolar bone, and then he individually inserted the tooths into the correct positions, right? So that is called diagnostic setup. So that idea gave an idea to Zia Christie and Kelsey Worth that it can be done by a removable appliance also, right? So that was the starting point. That was the brainchild. So the appliances are composed of polyurethane with added methylene diphenyl diisocyanate and 1,6-hexene diol. So this is the composition of Invisalign aligners, right? You have to know this. You have to remember this composition, this material. The material used in Invisalign is Smart Track multi-layered polyurethane and copolyester proprietary material. So this is a patented material which is employed by Align Technologies to manufacture the aligners commercially and deliver to the patients worldwide. Okay. Now, one more material that is called PETG, which stands for polyethylene terephthalate glycol modified, is currently utilized by the majority of clear aligner products producers, but polypropylene, polycarbonate, thermoplastic polyurethanes, and ethylene vinyl acetate and a variety of other materials are also used. So these collectively are basically known as medical grade plastic materials. What makes them apart than regular plastic is that there is lesser leaching. So microplastics do not get leached into the saliva and into the bloodstream, and they make their use in other medical applications also, in Foley's catheter, for example, in stents during angiography procedures. So medical grade plastic material is used to deliver the forces onto the teeth for orthodontic purposes as well, right? So what is the workflow? How do we go about treating a patient with Invisalign or with any other aligner brand? So first and the foremost, we have to take a polyvinyl siloxane impressions, or we have to go for intraoral scans, either way. But personally, I prefer scans. I'll tell you my story, how I was able to procure an intraoral scanner at my clinic where I practice. So polyvinyl siloxane impressions or a scan followed by wax bite, intraoral radiographs, photographs, x-rays and everything. Whatever essential diagnostic aids we have read about earlier. So the standard protocol, the standard data acquisition protocol is the same for all kind of treatment, whether it is conventional orthodontics, whether it is lingual orthodontics or clear aligners. I told you we are doing ortho treatment, so we have to follow that protocol one by one, step by step, right? Now it is followed by sending the impression. If we have taken a physical impression, we have to courier it to the people sitting at USA, at California. That's where the main headquarter is of Align Technology, right? So the impression is sent over through logistical means to USA, that R&D lab. The impression is scanned using a CT scan to produce a virtual model on a computer screen. Then after that, there's a particular software called Treat2 software, which is used to simulate the tooth movement, right? I'm going to explain one by one, each step. Then the fourth step involves CleanCheck. There's a particular software called CleanCheck, which is again marketed, proprietary by Align Technology themselves. It is their patented software basically. It allows the orthodontist to review, modify and approve the treatment plan. I will show you the screenshots of my own portal as I have done certain cases myself. I'm going to show you those cases in the slides to follow, right? Then after that, after you have approved the treatment plan, aligner fabrication is not, you should not completely dependent on the technician sitting behind the computer screens. You are the doctor after all, they are the technicians. So the treatment plan should be according to you. The only difference is that we have got so much of technology integrated into delivery of the appliance to the patient that sometimes we forget that we are the doctor. But it should not happen that way. It is your responsibility to understand the basic needs of the patient. It is your responsibility to plan the desired tooth movement, to execute the biomechanics, and you have to instruct the technician sitting at Align Technology at USA to manufacture the appliance in such a way which can replicate the tooth movement in exact same way as what is seen on the computer screen. That is your objective as a doctor. Okay. Then after the plan has been approved by the treating orthodontist, stereolithographic models are built at each stage. So they are the three-dimensionally printed models. I have already shown you those models in clinical videos. You can refer to them for reference. And then finally, Each aligner is fabricated individually, customized, disinfected, packed, and they are shipped to the respective doctors in all the countries across the world. Okay, so that is the basic outline of how the aligner treatment, how the workflow regarding aligner treatment works. So what are the materials used in various aligners? So I have included the name of a few other aligner brands other than Invisalign also, right? So we have Duren, Biolon, Zendura, Invisalign, of course. We have Clear Correct, MTM Clear Aligners, Phantasmeo, Nuvola, Strawman. You are not required to remember the names of each brand. The only thing you need to remember are the material used. So I told you, most of the aligner companies used PET-G material and PET material, and also they can use, sometimes they can even use polyurethane material. But Invisalign per se uses Smart Track multi-layer polyurethane and copolyester proprietary material, what I just told you. There's 2 slides before this. Now this we have already talked about in general. Now we are going to talk about each step one by one in detail. Workflow of clear aligners. So you have to select a case. First of all, case selection is important. So what all type of cases can be treated by aligner? I have a slide ready for you in the next few slides. I'm going to explain that. So which cases can be treated properly, which cases can be treated with surety, high predictability value, moderate predictability value, and low predictability value. So you have to select the case accordingly. Set a proper treatment goal, right? If you want to correct the crowding of the patients, that is a treatment goal. If you want to correct the anteroposterior jaw relationship, that can be treatment goal. If you want to correct the vertical relationships, you want to open a deep bite, you have to close an open bite. So everything can be a treatment goal accordingly. The same treatment goals what you make for conventional braces treatment, the same can be made for the aligner treatment as well, right? Now, one of the major indications of aligners and Invisalign is specifically to treat patients having mild to moderate crowding and mild to moderate spacing also. But nowadays we have got advances. You cannot stop technology from advancing. So similarly, we have got recent advances in the field of aligner technology as well. I'm going to discuss that as well towards the end of the chapter. What all new appliances have come into clinical practice, which are commercially available now. Everything I'm going to explain you. After you have selected a case, you have acquired all the data, you have taken a PVS impression, or you have done an intraoral scanning of the patient. The next step is to submit the case to the Align technology, either electronically, or you have to submit that PVS impression through courier, international courier. Then the Align technology procedure takes over, right? I told you the treat to software, then the teeth are set there, the teeth are set in the final desired position, and it is transferred to the doctor's Invisalign doctor site portal at ClinCheck software. So the treatment finalization, whatever customization, whatever movements of the teeth, whatever objectives you want to impart to the patient, everything has to be collectively understood by the doctor, by the treating orthodontist, and proper instructions in proper easy to understand language have to be typed into a proper dialog box, and those instructions the technicians will be looking into, and they will manufacture the aligner according to the instructions after you give that approval. Now after the approval, they will start manufacturing the aligners by a process known as stereolithographic apparatus. I'm going to explain that as well. So first and the foremost, the patient comes to you. You will have a thorough consultation with the patient. You are going to explain the pros and cons of conventional treatment, pros and cons of aligner treatment, everything. And you leave the decision to the patient. It's my personal opinion and personal recommendation. You should not sound salesy in your consultation, actually, What I do in my practice is that I simply tell all my patients all the options. I give them options of metal brackets. I give them options of ceramic brackets, self-ligating brackets, ceramic self-ligating brackets, lingual brackets, aligners. In aligners also, I give them options of different companies, what we just talked about. Then I leave the decision to the patient. Of course, I give them all the marketing material. I show them before and after for photographs of my previously treated cases. I have those photographs, those scan images right coming up next. I'm going to show them to you. So I give all the information possible to the patient regarding for what they have seek consultation at my clinic. Okay. So it's my personal belief, actually, you are a doctor, you are not a salesman. You are doing a treatment, you are not selling a product. So that mindset should work in your clinical practice, and that's why I try to follow. So where was I? So first and foremost, you have to do consultation, thorough consultation with the patient, with images, with scanning, everything. So I have an intraoral scanner at my place. I have an iTero 3D intraoral scanner at my place. Although that is the basic model right now, I might upgrade the model to a more latest one, maybe few years from now, if God permits me. So I do the scanning, I do the consultation, I do the oral prophylaxis, I make a treatment plan for the patient. I click photographs, I ask the patient to get x-rays done, OPG, lateral cephalogram. So whatever essential diagnostic aids are required, I do that. Okay. Intraoral scanners make use of structured light to record the hard and soft tissue digitally. So I have a slide ready for you regarding the principles used by different types of scanners, how they actually capture the intraoral structures, and how do they present in the computer software. I'm going to explain that also. So this is the scanner I have at my place. This is called iTero Element Flex scanner. It's a portable scanner. There are different types of scanners available. We have got iTero Lumina. This is right now, iTero Lumina is a state-of-the-art intraoral scanner available worldwide. It is unbeatable. I have had a demo. I have had a privilege of attending a demo of iTero Lumina at one of the conferences at Chennai last year. I went to Chennai for that. There was an Invisalign conference. So it's actually it's class apart, and the maximum time you need to scan the entire mouth using iTero Lumina is less than 30 seconds. Can you imagine? Less than 30 seconds. And your scanning is done. It's so accurate, it's so powerful, it's so fast. But I usually take 5 to 6 minutes using my intraoral element flex scanner. So, it's all the difference of technology. The difference is in the software. And of course, the difference lies in the hardware as well. Okay. Then we have got iTero Element, iTero Element 2D, iTero Element 5D. So different gradations of iTero scanners are available to choose from. Okay. So first things first, I've done the consultation. I've done the scanning of the patient. So here I am at my clinic, and she is one of my very beautiful patients who has come to me seeking her orthodontic treatment. She wants to beautify her smile. So she has got certain questions which she is going to ask me, and I'm going to explain it to her.
Hi, sir.
Hi.
I wanted to get my teeth aligned.
Okay.
See, you can see the gaps here. I wanted to close that gaps. How can I do that, and
So
what will be the
basically-
treatment?
Okay, so basically you want to improve your smile. You
Yes.
want to look even more beautiful than what you are right now.
Of course.
Okay, fine. So I would like to first examine your case.
Okay.
Then we are going to discuss about the different options which are available in today's world.
Okay, sir.
Please open your mouth. Please close your mouth. Okay, close your mouth, close your teeth. So as I can see, you have perfectly healthy teeth, healthy gums. All you need is little bit of aesthetic correction, which can be done by braces treatment or aligner treatment, whatever your preference is.
So, which is better?
See, for your age, I would recommend to go for aligners. Reason being, you are a student right now. And as a student, it's little difficult to take care of the braces at the same time.
taking care of what to eat, what not to eat, how to maintain proper hygiene, everything. Taking those things into consideration, I will recommend for you to go for aligners. That is my recommendation for you.
So which is more aesthetic? I want to go with more aesthetic way.
Okay, so aesthetic, we have got two options. We have got ceramic braces and we have got aligners, as I was just saying.
Okay.
But before that, would you like to see a real-time demonstration of how your teeth are right now and how they are going to be at the end of the treatment? Like how much improvement your smile is going to have. Do you want to see that?
So how can we do that?
I have a very sophisticated state-of-the-art 3D intraoral scanner at my place, at my clinic. So we can quickly scan your teeth and we can demonstrate your teeth from all the angles on the screen. And using that software, we can demonstrate how your teeth are going to look like at the end of the treatment. It is just going to take hardly 10-15 minutes maximum.
Yes, sir. Please do that.
Do you want
Yes,
me to
yes,
do that?
Oh, of course.
All right. So, ma'am, this is your smile simulation I was talking about. You can see how your teeth are right now, how there are spacing between the teeth right now.
Yes.
And this is what we are going to achieve at the end of the treatment. You see, there are no spaces, the teeth are properly well aligned, and you are going to witness tenfold increase in your smile, tenfold improvement in your smile. That's going to improve your confidence, like it will go above the roof. So this is from the right aspect. You can see this is right now. Here there are some spaces between the canines, distal to the canine, mesial to the canine, and this is how we are going to achieve. There will be no spaces at the end of the treatment. All the teeth will be completely properly aligned with each other. Similarly, on the left side as well, you see here, these are spaces here, and there won't be any spaces at the end of the treatment. You can see how the bite is going to open up. You can see some deep bite here. Your upper teeth are overlapping your lower teeth more than normal right now, and we are going to correct that as well here. And you see here, this is the mandibular dentition from the above. You can see here how the teeth are, the internet spaces here, and all the teeth are going to be properly aligned and in a U-shaped arch properly. Similarly, we have the maxillary teeth also. See, spaces mesial to the premolar, mesial to the premolar, and we are going to retract all the teeth, close up all the spaces, and that's going to improve your smile.
So
This is what we are going to achieve.
how much time it's gonna take?
See, it depends on the severity of the treatment basically, ma'am. So few cases get completed up to a year, within a year. Few cases require a little more, but still be on an average, if we talk about the average time taken for an orthodontic treatment to be done properly. Few people I have seen, they take shortcuts, but I don't believe in shortcuts at all. So I take proper time for completion of the treatment. That's going to last approximately 1.5 years.
1.5 years. Okay. And so what about retainers?
Ma'am, retainers are a part of the treatment.
Okay.
They are not given as an option. They are a part of the treatment. Like,
I have to wear it for.
yes, you have to wear the retainers.
Okay.
As I was saying, a part of the treatment, they have to be worn for at least for 1.5 to 2 years after the end of the treatment.
Okay. So for how much time I have to wear retainers a day? And
In a day,
Hours.
at least 20 to 22 hours in a day is required for the retainers to be worn.
Okay.
Because we are going to, there is some memory present within the tooth. Like we are going to change the position of the teeth from one part to another part, but the retainer is going to break that memory. The possibility of the teeth to come back to the original position, that process, that's called tooth memory. That tooth memory is going to be broken by retainers. That's why it takes time, and that's why the patients have to wear the retainers for that much time.
Okay. And so what about hygiene?
Hygiene has to be maintained properly, ma'am. So as many times you have meals in a day, so that many times you have to maintain hygiene properly. That is a must. It doesn't matter you're wearing aligners or braces, hygiene has to be maintained properly.
Okay.
So the success of the treatment, I'm doing my part of the job, but the major part of the job has to be done by you. How? You have to maintain hygiene properly. You have to follow the instructions, especially the food habits. They have to be followed properly.
Okay, sir. So what other options do we have other than aligners?
We have metal braces, we have ceramic braces. Ceramic braces are tooth colored. We are very transparent, as your main concern was aesthetics. So ceramic braces could be a good option for you. Then we have self-lighting braces, we have lingual braces. I'm going to show you each one of them. So these are the conventional braces. These are called the metallic braces. You can see they are of the color of steel, and we have different colored modules they are certain elastomeric modules which come in different colors, which are used to ligate the wire with the brackets. Like we have blue colored, we have transparent colors. So these are basically metal braces, as you can see.
Okay.
These are self-lighting braces, as you can see. Here I have not used any elastomeric modules to attach the wire with the bracket. That system, that mechanism is inbuilt within the bracket architecture only.
Okay.
So you can see they are technologically more superior than the conventional metal braces. So the advantage is that we have little faster result, and they are better to maintain hygienically.
Okay.
And now we have tooth colored ceramic braces as well. As I was saying, yes, aesthetics is your main concern. So you can consider this also as a treatment plan. You can see the brackets are of the color of the teeth, translucent white. So they will not be visible from a distance if somebody is talking to you.
Okay.
You are going to have a very discreet kind of a treatment.
Okay.
Then we have lingual braces. Now, the braces which I just showed you, they are put on the outside of the teeth surface. The lingual braces, as the name suggests, they are put on the inside of the teeth.
Okay.
So they are again very discreet, but the only problem with these braces is that they might be a little uncomfortable for some patients, especially for the tongue movements.
Okay, sir.
Now we have aligners. So these are the best in class for you.
Okay.
These are the best treatment modality available for students, for working professionals, and those people who require aesthetics, who have aesthetics as a primary concern of treatment. Right? So these are Invisalign aligners, you can see. So these are the aligners. You can feel the texture yourself. So these are the aligners which the patient can wear themselves. They can remove it themselves. So they are very transparent. They are very discreet also. Nobody is going to come to know that you are undertaking some treatment from an orthodontist.
Okay.
So whatever problems we had with braces, like whatever food restrictions, hygiene restrictions we have to follow proper hygiene routine. Everything is taken care of by these aligners. It's simple. You just have to wear the aligner. Then if you want to eat something, just remove the aligner, eat whatever you want to have. Just brush your teeth, brush the aligners, put it back. That's very, very simple for you.
Okay.
And the treatment is relatively faster also in aligners as compared to braces.
Okay.
So ma'am, I'm going to demonstrate you few of my previously treated cases so that you can have an idea. Like I showed you the demonstration first,
Yes.
that what your teeth are like now, what your teeth are going to be at the end of the treatment. I have done certain cases which are little complicated in your case, very similar to your case, little less complicated in your case. Every kind of cases I have done previously. So I'm going to show you few of my previously treated cases also. So you can just have a look and you can appreciate the amount of changes what we have been able to achieve at the end of the treatment.
Quite hard work, huh?
It's all dedication. I love my job, so it pays off like that, So you can see here how much crowded the teeth were in the beginning. So at the end of the treatment, how the teeth were looking like. This was another very severe case. It required extraction of 4 teeth. Four premolars had to be removed, and that's the result what we achieved at the end of the treatment. This is also a good case, a transposed canine case, and how I corrected that case at the end. So I'm going to show you, this is a case very similar to your case. As you can see, for you right now, I think this should be a motivating factor. That's what I believe personally, because this was a lady very similar, very close to your age only. She also had the same problem. She came with the same chief complaint, having gaps between the teeth. The smile was very unaesthetic. She was very underconfident. So she came to us. I did the treatment for her, and that's how I completed the case. There were no spaces in between. This is the maxillary view before and after, you can see. And that's exactly what we are going to do in your case as well.
Okay, sir.
So you can see here, look there, how the patient's smile is improved. This patient came to me with a very big diastema in between. So she required a frenectomy surgery also. And this is how we have completed the case. You can see the drastic improvement in the confidence, in the way the patient is smiling.
Yes.
So that's actually visible on the patient's face, you know. See here, how before and after changes you can see. So these are the cases I have treated before. Few cases are treated by aligners, few cases are treated by conventional braces, metal braces, ceramic braces. So it's all mix and match. What I just want to tell you is that how the smile has improved. There's a complete transformation of the face by this treatment. So that's the point I want to make. That's why I'm showing you these pictures of the patients.
Okay, sir. Thank you so much, Dr. Kunal. All my questions are answered. And let's start the treatment as soon as possible. Thank you Thank you so
welcome,
much.
most welcome. Thank you so much. Thank you so much.
So these are the different scans of the patient, of my own running patients. Few of them have been completed and few of them are still running, right? So after the scan, I present them a composite scan, very similar to the photographs what we saw in the Essential Diagnostic Aid chapter. So this is the right lateral. This is the frontal view. This is the left lateral. This is the maxillary occlusal view. This is the mandibular occlusal view. Right? Different types of, color combinations available. You can have a proper color combination. You can have a monochrome color combination just to show the patient. So this is a very good diagnostic tool basically. If you are able to scan the patient, if you are able to show the patient what exactly your teeth look like in 3 dimensions, so the conversion ratio is actually high. The patients do get motivated. They, I'll tell you a secret actually. As I was saying, you should not sound salesy. You are not selling a product. You are doing a treatment. You are helping the patient achieve the smile of their dreams. You are providing your own service, right? So you should tell the patient what is wrong with them. Then the patient will automatically ask you, okay, this is the problem. What can we do about it? And that's where you're going to hit the jackpot. First, you have to educate them about the problem they're having. Then they will ask you the question themselves, what can be done about it? And then you can go about explaining the procedure, whatever is required for them. It is applicable for orthodontic treatment, prosthodontic treatment, implant treatment, bone graft surgeries, periodontal graft surgeries, you name it. Okay. So this is a scan of one more patient just for your reference. So this patient had a midline diastema, and this was an overseas patient. He came to me from Iran. He got my reference from one of the previously treated patients. So this guy came to me from Iran, and he visits every 4 to 6 months, once in every 4 to 6 months. He's a student there. He's studying in Iran, and he has a family in my hometown, right? So he comes for visits at my clinics in 1 to 6 months from Iran. Now, this scanner can also be used for multiple purposes. It's a good consultation tool, I told you. Of course, it is used for aligner. It can be used for fixed prosthodontics also. You see here, I have done a crown preparation of this particular patient, 1/6 tooth number. So I have done the crown preparation, I have taken a scan, and I have sent this scan to the respective lab, to the concerned lab. They will do the analysis. They are going to print the 3D model. I showed you in the clinical videos previously. You can refer to them if you want to. So that scan is sent to the lab. They create a 3D model again by the process of stereolithography. They make that physical model, and over that the cap is made and it is delivered to the doctor. And then the doctor has the obligation of delivering the cap, delivering the fixed partial denture to the patient. Okay. So this is the scan from a different angle. You see accuracy of the scanner is so much more. You see the margins of this particular scan are so much properly visible. And of course, needless to say, you have to do your work properly, with full intensity, with full dedication. Only then you can you can deliver that results what you want, what you desire. That is my personal belief. Pleasure in work always gives perfection in results. I am not perfect, nobody is. There's always scope of improvement. So I am a lifelong learner. I am a learner first. I am a dentist later on. I am an orthodontist even later on, right? So I always want to upgrade my skills. I keep myself updated by latest technologies, latest hardware, software, which is getting available in the market commercially. So it's always important for you to keep yourself updated because, patients are very smart these days. I have come across patients who consult ChatGPT, who consult Gemini, even Perplexity. They will ask, they already know what they are going to get the treatment. YouTube, Instagram, Facebook, you name it, all social medias. They have all the plethora of information, right? They are going to ask you while having a consultation with you. So it is your responsibility as a doctor, as an orthodontist, to be one step ahead of the patient because you never know what the patient is going to ask you. And if you're not able to answer those questions, whatever the patient is asking you, the patient will lose trust in you instantly. And once the trust is gone, forget about getting the treatment done. Okay. Now this is one more case I have just recently completed at my clinic. So I sent it to a different lab which was based at Bangalore. Just last week only I have completed this case. You see, I have just sectioned the 3D printed model. This is how I have received the package. See here. I have done the crown preparation. This patient required a bridge in this area from the second premolar to the second molar on the second quadrant of the patient. So I have done the crown cutting, I have done the crown preparation. You can see here. I have recorded the margins properly. I have done the scan. I have sent it to the lab and they have presented the work to me in this format. And I was very happy. While luting the bridge to the patient's mouth, ever since I have started using the scanner at my place, not even once I have found difficulty, I have found any occlusal high points. So there was negligible need of occlusal equilibration. That flattening of the high points, what dentists normally have to encounter in their clinical practice at the time of delivery of the fixed partial denture. So if you are able to integrate digital practice in your clinic, you are already one step ahead of the rest of your competitors. Okay, it will require some investment. It is a capital intensive machine. It's a capital intensive technology. So if you're able to do that, I would strongly recommend you to do that at your clinic. Now, I also showed you occlusogram in one of the lectures, supplemental diagnostic aids. So this is an occlusogram I have obtained after doing the scan of the patient. So for orthodontic purpose, I have been able to create a heat map occlusogram showing occlusal contacts between the teeth, right? So I told you in the chapter on supplemental diagnostic aids as well. So we have a universal color coding mechanism. So where the red colored dots show that the contact is too much and the blue colored areas show the contact is not there, or we have a proper interocclusal clearance between the teeth, right? So if you find such problems where there is uneven distribution of the teeth, before the start of the treatment, you can modify your treatment in such a way, or you can move the teeth in such a way with the objective to allow uniform distribution of the occlusal forces at the end of the treatment. That is shown by Invisalign outcome simulation. I'm going to show that as well. Okay. Now, next part of this chapter, how do intraoral scanners work? Broadly, they work by using advanced optics and light projection to capture thousands of high-speed images of the inside of the mouth, which specialized software then processes in real time to create a precise 3D digital model on the computer screen. So you insert the scanner in the patient's mouth, you project high-intensity LED lights. Those light beams are projected onto the facial surface of the teeth. Those lights are reflected back. That high-intensity LED light is reflected back. It is captured by the sensors and cameras in the wand of the scanner, and that is transmitted to the software, and those algorithm of the software, so sophisticated algorithm of the software, processes those images, thousands of images in real time to produce an image on the computer screen which can be played with in 3 dimensions. That is a basic outline of how the scanners work. Data export and use as STL, it stands for Standard Tessellation Language, or PLY, it stands for Polygon File Format, or STF, stands for Triangular Format. So these are the different formats, these are the different extensions rather, which are used to save the file on the computer screen, on your computer hard disk. Now, all the scanners work mainly by 4 principles. First is confocal microscopy or confocal laser scanning. In other words, in simple words, simply point and stitch. That means you simply have to insert the wand of the scanner in the mouth, right? Then you start the scanner and it's going to display that image on the computer screen in real time. Examples, iTero Element, which I have, 3-shaped Trios. These are the 2 main brands of intraoral scanners which work on the principle of confocal microscopy. Next method is triangulation. It's a little difficult to understand mathematically, so I have omitted that part. You must only remember that it works on the principle of Pythagorean theorem. You know Pythagoras principle? That length and width of a triangle, based on that you can know the exact length of the hypotenuse of the triangle, right? So that is Pythagoras theorem. In very similar terms, this particular scanner that is called CEREC OmniCam by Dentsply. Now Dentsply is an international brand from Switzerland. So this particular scanner uses Pythagorean theorem to capture the images of the intraoral structures. Then we have active wavefront sampling, AWS, or 3D in motion wave video recording. So this is followed by 3M Lava COS. And we have structured light projection, where distortion of light fringes converts to 3D maps of oral tissues. Okay. So basically you are going to remember confocal microscopy and triangulation technique. These two are the most important methods of how the intraoral scanners do work. For those who do not have a scanner, not everyone has a scanner at their place, right? For them, we have to go for polyvinyl siloxane impressions. In my language, I call it high definition impression. High definition impression, why? Because look at the marginal gingiva, how beautifully they have been captured. So this is the impression of one of my own patients before I started using the scanner. So this is my own patient. This impression is of my own patient. So you have to go for a heavy body impression first. Heavy body impression first, followed by light body. Followed by light body. Okay, I'll tell you one story here. It is normally recommended to use before that there are 2 types of polyvinyl siloxane impression material, condensation silicone and adhesion silicone. You know that already, right? So condensation silicones, they have a disadvantage of dimensional inaccuracy because there's a byproduct called ethanol which gets evaporated in the atmosphere. So there is polymerization shrinkage if the impression is left without processing for a long period of time. There is polymerization shrinkage, right? I'll tell you my story here. The reason why I decided to switch to intraoral scanner was this actually. You know, I made an impression using PVS of a patient, and I sent it to the United States for processing for Invisalign treatment. And I used a condensation silicone material. It was in the very beginning of my career. I was not having that much experience. So I just bought that C silicone from the market. I very well took an impression. I was happy that I'm going to start an Invisalign case. Very, very initial part of my career, you know. So I sent it to the people at United States and it took 15 days to reach. Then I realized someday I was in the middle of my sleep actually. I still vividly remember that incident. I was lying on my bed and then a thought clicked me. What was the thought? What will happen if the impression gets distorted? And that's exactly what happened. I received the aligners and then not even a single aligner got fitted in the patient. The entire aligner were wasted. I had to get a new scan done. I called the technician to my place. I got the scanning done again. I repeated the entire process, and then the new aligners which came to me, they fitted well, much to my relief. So the point I'm making is that if you're not using good quality instruments, if you're not using good quality material at your place, forget about delivering quality treatment to the patient. That's a takeaway I want to give to all of you. Little bit of investment is going to save thousands and lakhs of rupees later on for you. It might look towards the higher side, it might look little capital intensive today, but it's going to give you returns. So that was the day I decided that enough is enough. This has happened with one patient, it should not happen again with other patients. So that was the day I decided I need to have an intraoral scanner at my clinic. So I started working towards it. I started working day in and day out. Gathered the courage, gathered the financial assistance, not assistance actually. I worked for it actually and I earned it. So that's the story I wanted to share with you all. Okay. Now this is the bite registration. What you take. It's taken using so this bite registration particularly is taken using a light body material, right? This is how it is done. This figure, you have to apply the light body material using a dispenser onto the occlusal surface of the teeth. Ask the patient to bite properly. Keep it in a bitten position until the impression material has set properly. Take it out and you have to send the impression material along with the impression and the bite registration together in one package to the United States through couriers. Now, after the impression has reached the lab at United States, they are converted into dimensionally accurate 3D electronic models by means of computer-aided scan. So the impression is scanned using CT model, using CT scans. After scanning, it is followed by synthesis of 3D virtual models. So here in the first figure, CT scanning is being done. After CT scanning, we make virtual models on the computer screen using sophisticated algorithms of the software. These 3D models are then treated with Treat2 software that is called 3D virtual setup. You see here, this is a 3D model. This is the 3D model. And whatever type of tooth movement you want, that can be shown that can be incorporated in that 3D virtual setup. So this figure shows blue colored as the original position of the teeth and the white colored as the corrected position of the teeth.